Hello everyone. Just wanted to share with you that I received the XCP kit. Let me go ahead and flip this. It's a nice package, and I ordered just to demonstrate and to go together with the PowerPoint presentation that I have available on YouTube. And it is a nice set of rings by blocks and arms. Once again, we have the yellow. Let me turn this a little bit. Yellow by blocks. Then we have the red ones. Of course, the yellow ones are for posterior teeth. Red ones are for bywinds. Then I'm gonna go up here, and you have the blue ones for anterior teeth, and those green ones on the left corner are for root canal X-rays. Now, on the upper right corner, which is this one, you'll see the rings. And you have, let's see, we got two yellow ones, one blue, one red, and one green. And then down here in the middle, we have a few indicator rods. It looks like we have, or indicator arms. That sounded funny. So we have two yellow ones. It looks like we have one blue, one green. The green is kind of hard to see the color, but that's right there in the middle. And then we have one red for the bywing X-rays. I am going to pause this for a second, and I'm going to open the package to see what we got. Alright, hold on a second. Alright, so I started recording. I'm using a little arm to hold my camera. Let's see if I can do this, because it's kind of hard to see what I'm doing through the my camera, my cell phone. And actually that doesn't work, so I have to flip this over, so we will make a mess. I'm trying to see the video at the same time, just to make sure I'm getting what I need to show you. So let's put this on the side for now. And yeah, this came off, so we just put it back over here. Yeah, it goes right there. Okay, so once again, you have a nice set, and I'm going to show you something that I really liked. Sorry, move my camera. So it came with this poster, and let's move this on the side. The poster is actually really cool, because it shows you exactly where you position each by block with its corresponding color coding. So for instance, this yellow one, okay, it's for posterior teeth, so it shows you the pictures of which ones are posterior teeth. And right here too, okay. And later I'm going to show a video how this works, because you flip it and it works for the upper right and lower left, and then you flip it again, it goes for the works for the upper left and lower right. So it's kind of interesting. So that's the yellow one. Then also the blue one, which is for anterior teeth. Let me fold this. It's just it will be probably easier. Okay, now let's fold this one more time. Okay, right there you can see the blue one, which is for anterior teeth, and it shows the a chart of the teeth of the mouth, and it's actually showing the blue teeth, which are the anterior teeth, which is really cool. Again, those are the yellow ones for the posterior. Okay, and it gives you nice information right there, so you can post this on the wall. Here is the other side of it. I had to fold it because it doesn't fit on my camera. Okay, so then you have the red. Although the color right here doesn't look really red, we know that's the red because that's for bywinds, and it shows you how those bywinds are highlighted on this anatomical chart of the teeth. Same thing on left side and the right side. Okay, and it also shows you the green one for the bywinds. Okay, same thing, color coded green. Okay, upper left, low. I'm sorry, upper left, lower right, upper right, lower left. So this is pretty cool. So whenever you have a chance, and if you get one of these kits, you can actually post this on the wall, and it helps students or any new dental assistant learning X-rays how to assemble and position these XCP kits. So real quick, I'm gonna put this down, And I am going to open the actual case. It looks like, yeah, it's just like pressured. That's pretty cool because I didn't have to use any knives or scissors, anything sharp to open it, so it cannot seals. So it looks like you can actually use this for storage. Well, something you have to consider, once you use them, I don't think you want to keep these, okay, because that's just for maybe we have a few sets, if you only use these on Dexters, then that's okay. But if you use it on patients, don't use these because they need to be actually sterilized and bagged and separated completely. So real quick, let me go over this real fast. Let me start with the posterior. For some reason, I always start with the posterior teeth. So this is a posterior bite block. As you can see, has a little bit of an angle that is to hold the X-ray. Okay, it does have the openings right here where the metal arm goes, and it has it on both sides because at some point you flip these depending upon which side of the mouth you are taking X-rays on. So let me put this back for now. I am taking, let's see if we can see the video. I'm taking the blue one, the blue anterior bite block, and same thing, has a slightly angled backing, which is this one right here, and has the openings again on both sides. This is one, and here is the other one, so you can place or insert the metal. Okay, let's put this back where we found it. Then you have the bite block. Okay, same thing, it's a little long. That's so you can reach back teeth, molars and premolars. Okay, this one has also the openings. You can see there for the indicator arm. And then we have the green one. Okay, this is also slightly different because again, you take x-rays when you are or when the doctor is working on a root canal, on an endodontic treatment. So now let's go over these rings here. Sorry, again the video, I need an assistant. So here's the green one. Okay, I'm gonna hold it in a way so you can see the difference between each ring. This one is the piece or the where you insert the arm, it's a little bit on the side, as you can see. All right, I'm actually looking behind the camera. Make sure you see the same thing I'm seeing. Okay, now the red one, it is for the bite wings. If you notice, the receiver for the arm is actually straight. It's pretty centered to the ring, to the circle. The blue one is similar to the red. Okay, the insertion point is right in the middle. Okay, and here's the other one, but for posterior teeth, this is different. It's easy to see that the receiver portion is off as well, and it has a reason for it. I'm going to show that in a couple of seconds. All right, so let me show you how to assemble the posterior XCP kit. So I had to go around, I had to move, sorry. Okay, that way my hands fit. Okay, so notice that again you have the openings where you insert the metal arm. You have a couple options. You can either use the first two openings and insert it like that, okay, or you can use it towards the back. I'm gonna tell you what the difference is because I noticed that some students or some X-ray technicians don't even know, and in fact what's a little sad is that some instructors don't even know either. But let me show you what the difference is. If you look at the bite block like this, let me take this out first. If you use this, notice that there is about 1/4 of an inch of the metal sticking out from the bite block. Okay, so Now let me show you the difference. When you use the two back openings, okay, there is nothing sticking out. The trick right here is not a secret, but it's more like a trick. If you have a patient that has a small mouth, you don't want to use this one because now this extra quarter of an inch creates more space in the mouth, and sometimes it hurts when the patient bites down or it doesn't fit right. So whereas when you push it, or actually place it in the back, now you're just dealing with the length of the bite block and nothing coming out or extending out. All right, my recommendation is to always insert it all the way in the back. All right, that way you don't have to deal with any space or limited space in the mouth. Now the next one is the ring. I'm actually adjusting myself. Okay, so the ring, I'm sorry I'm too close to the camera, but all right, so notice we talked about this before. This receiver is a little bit off, so there is a reason for that. Okay, number one, let's insert this the right way. So you place this, and as you can see, let me move this farther so you can appreciate. You can see that the bite block, the backing of the bite block, is right in the center of the ring. Okay, it's not off. I'm trying to get the right picture so you can see on my camera. Okay, now this is ready to go. All right, this will be used for an upper right side x-ray on the patient, and if you just flip it, it works for the lower left side. Okay, now if you don't place this right, let's say you go like this, you flip this, sorry, okay, this is wrong. Okay, notice that let's see, I'm trying to show the camera, it's not centered. Okay, this is not right, so it's like this. Okay, automatically you're gonna get a concut because if the film will be sticking out up in this case, so the radiation will go through here. Okay, and you will cut most likely the roots of the upper molars. All right, so you gotta be careful with that when you're teaching your students. So if you're a student, make sure that when you look at it, this backing, and especially when you place a film, it looks right in the center. So let me flip this over one more time. Now, see the difference? Okay, right there. Sorry. All right, let me see. I'm trying to see through my camera as well. Okay, this is correct way. Now, if you were to use or you have the need to take an X-ray on the lower left side of the patient, you have to make some changes. And I'm gonna pause this because I'm gonna show you something real quick. All right, so I went to grab a Typodont. This is a nice orthodontic Typodont that I actually made myself. And I am going to make a video and show you how to convert a regular Typodont into an orthodontic Typodont, and you don't have to spend a lot of money. So, but that will be another video. Okay, so let me show you right here. So I keep on moving my camera. Okay, so I assembled this for the upper right side. So let's go over this real quick. This is your patient. Okay, this is the right side of the patient, and that's the left side of the patient. Okay, now because your right side it's on this side, this is technically my right side, but that's not the right side of the patient, it's the other way around. Okay, so don't get confused with that. So this is the right side of the patient, that's the left side of the patient. Now the patient opens his mouth or her mouth, so I'm using my two hands to do this. Okay, and I'm trying to look at the camera so I can place this right. So this is how you place the bite block. You tilt it a little bit so you won't hurt the patient's palate. You place it inside, keep on tilting, and you have the patient bite on it. All right, and now let me turn this around. This is how you're looking at it. Once the patient is biting, I have another video on this. I'm just giving you a general idea right now. Okay, you bring the ring as close as you can to the face. I don't recommend the ring touching the patient's skin because they tend to move. All right, but if you notice, I supported my fingers with this part of the arm and right here, and just squeeze down slowly. And now you have a place for the upper right side. So you can take an upper molar x-ray and then you turn it a little bit and then you'll be able to take the upper bicuspids. Okay, let's see. I hope this is coming out okay on the video. Now, to take it out, of course, the patient opens, tilt it out so you won't actually hurt the patient. Take this out. Now you're gonna take this side, the same position works for the lower left. So now all you have to do is turn the XCP kit upside down. Sorry about my hands. I don't want to make sure they're not on the way. This is what happens when you do this by yourself. So anyway, see how it works for the lower? In this case, instead of tilting it up, it's going to be tilted down. Patient bites down so it won't hurt, because sometimes this one hurts on the bottom. Okay? The film should not be on top of the tongue, or else you'll miss the apices. Okay? Again, you squeeze this, get it close to the face. You can see how close it is. Alright? And then you can see how the actual x-ray is going to come. Let's pretend this is the PID. So PID is aligned and you take the x-ray, right? I'm just pretending that's a PID, the x-ray machine. Now, that's for the molars. Always move this out of the way before you take it out or adjust it. Patient opens, you get a new film, patient bites down. You bring this closer and you'll take the next x-ray. Again, bring the PID close. Okay, and x-ray, and get this out. The way I'm positioning, I guarantee you I will not get any concuts. I've been taking x-rays for many years, so sometimes I can do this, or it seems like I'm doing it simply or very easy, but I know where to adjust it for or to avoid overlapping. Okay, let's open this a little bit, take this out. Okay, I'm gonna pause the video a little bit. Okay, very good. So we just demonstrated how to assemble the posterior XCP kit, all right, and kind of how to place it on the patient using my orthodontic typodont. Now, real quick, I am going to assemble the bywing. Okay, so here's the bywing. Now for this, I am going to need to pop this. There you go. All right. Now, this is a little tricky, okay? It comes to a preference according to some people, but according to me, it does not. Some people assemble the biblock of the bywing to the metal rod of the bywing this way, facing this way. And let me show you something else. So here is the red. Okay, so you place it, so it has a little square right there where it fits. Okay, perfect. All right, some people like doing this, some extra technicians do it like that. I found that sometimes the patients bite in a different way, that as they biting down, they move it. Okay, I don't know if I can demonstrate that here, but you know, you have to try to see what works best for you. So if you're using it this way, okay, let me move back so it won't be too close. Okay, the patient bites down. Okay, sometimes again, some x-ray techs like that, and again, just close this. Okay,